Hello, everyone. My name is Ben Coletti. I am a first year student in Indiana State University's Doctorate of Athletic Training program. Today, I would like to create this video project to talk about evidence-based practice um, and kind of be able to share my own opinions about evidence-based practice, and then also um, share an interview or two interviews that I conducted, one with a young professional practicing athletic trainer, and another with one with over 10 years of experience in practicing athletic training. Um, and I want to do this to kind of show a couple different perspectives of evidence-based practice. One from myself being a recent graduate, another from the young professional standard, and then uh, another one from a perspective of a more experienced athletic trainer. Um, so, in starting with this project, I want to start with my opinions before then going into the interviews, and then at the end, after the interviews, I'll kind of present another section that I think will help tie those all together, and I'll share a little bit more of my opinions. So I think before I start this, it would be fair to everyone watching and to myself to kind of establish where I am at in terms of evidence-based practice before going into the interviews. For me and my professional practice so far, it's been very limited. I just recently graduated from Illinois State University in their undergraduate athletic training program in May of 2019, and so I'm a recent graduate, and uh, so to me, not having the same amount of clinical experience as either some of my colleagues or the people that you hear from in the video in just a little bit, I think that my values of evidence-based practice will come more from what I've been taught in my curriculum, and then what I have seen people use in my preceptors or other people that I've worked under in undergraduate school. So to start off, I think it's fair that I try and kind of show what my definition of evidence-based practice is. And to me, I see evidence-based practice as the combination of three core ideas, and I almost want to call them pillars, just because it's kind of what supports the entire idea of evidence-based practice. And those three are um, clinician expertise, research, and patient values. I think that those three things are imperative to every time that you want to talk about evidence-based practice. Um, there has to be some sort of research. There has to be a clinician that is skilled enough in that area to understand if that research is viable and reliable, but also need to be skilled enough that they can then put that into practice if they do find that there is something um, that has research behind it. They need to be able to use that effectively in their clinical practice, and then taking into consideration the patient population that they work with and the values of those patients, making sure that those patients aren't going to be uncomfortable with any certain technique. So the first thing that always comes to my mind is dry needling. Not everybody likes needles. And for a lot of patient population, they don't feel comfortable with dry needling. Um, Now, it may be the role of the clinician to tell the patient that it is safe and it is an effective way and that they feel that it is um, best for the current situation. But if at the end of the day that patient does not feel as though they would want it, then still continuing to perform that would not necessarily fall under evidence-based practice. Um, if the patient truly will have a negative reaction to it, then you may not see the clinical outcomes that you're hoping for. So that's kind of what I always think of when I first talk about evidence-based practice, and everyone says like, oh well, what would be an idea of when the patient value has to come in? That's the first thing I always think of. So then to kind of piggyback off of, with my definition and everything and talk about how I utilize evidence-based practice in the athletic training room, like I said, with not having as much clinical experience where I've been able to be completely by myself, a lot of what I have used has been observed under preceptors. And so I think I've been very fortunate to have a lot of preceptors that have tried to do evidence-based practice techniques and have done a lot to help me um, become a clinician that can be a little bit more critical and that can kind of identify when something is reliable and when it's also viable for you to do. So that kind of rolls into a point that I'm going to maybe um, explain a little bit more in a second, but and that just being how prepared I feel in in kind of going through with the practice. So, for me, um, my first big experience with clinical practice will be coming up soon at a high school, and so with limited resources, I may not be able to have everything at my disposal. And so, just for an example, um, if I have an athlete who is experiencing pain, and my goal for that day is to modulate their pain, for me, um, I might not have different types of modalities that I can use for pain modulation or that have been known to be helpful for pain modulation. And so maybe I would have to explore other routes, whether that be a different manual therapy, whether that be a more available modality, whether that be the suggestion for them to go and seek out that modality themselves. Um, that's kind of where I see uh, potential blocks for me wanting to use uh, evidence-based practice in my athletic training room. Other than that, though, the goal would be to always have evidence to back up what you want, right? You always want to present a reason for why you're doing something because that's what's going to help your patients and anybody involved with your patients have more trust in you and that they see that you truly know what you're talking about and you're not putting them through something that seems unnecessary to them or seems uncomfortable to them. So, again, like I had kind of mentioned before, talking about how prepared I may be to follow through with a lot of the practices. I feel like I said earlier, I've been very lucky that I've had preceptors who kind of push me to do a little bit more than just what needs to be done. Um, the undergraduate experience can sometimes be shrouded over at different areas of, uh, well, you're just kind of an observer. You might not be able to get as much hands-on experience because this is a high-level football team or basketball team, if that be the case. Whereas if you have different experiences at a high school or in other settings, you might be allowed to have more hands-on just because of the, I guess, priority that they decide to put on those athletes. So with my experience being so fortunate to kind of have the opportunity to um, apply hands-on skills and practice them with real-life patients, but also being asked to look up articles, read articles, do things outside of the clinical practice. Um, it's already been able to kind of help me look at things differently and to not take everything at face value. Um, I've also been fortunate enough to take a research class in undergrad that very quickly kind of went through validities uh, externally and internally and the reliability of different results, how to read results, knowing what is statistically significant, and how to kind of go through different evidence and make sure that it's not politically charged, and so it's not being published only because it came out somewhat positive, and that to always kind of look for something else that might not align with those values. So I think overall, in saying that, I do feel prepared. There will be times where if I go to an evidence-based practice session and um, I decide to sit through and learn about a technique, um, even if it's an hour-long presentation and there is some hands-on to it, I might not be 100% comfortable to do it if I've had no previous experience. And that's okay. And that's why I need to feel prepared enough to then want to continue or know when to not pursue it, um, if that is the case. I think that's kind of where the barriers and conflicts come in because of your familiarity with some things. I think some people think that evidence-based practice can just take a lot of time, and that is very true. Um, but at the same time, as a clinician, I do feel that the time is worth it if it does make that impact on your patient. My goal is always to provide the best patient care I can. And so if I'm not doing everything I can, then I'm not providing the best patient care. So with that being said, I'd like to stop my part of this project here, and then I will pick up after the last interview and just kind of provide a closing statement to kind of wrap everything up. So moving through the second interview, or the first interview that I conducted, the second part of this project is done with Megan Smith, and you'll hear more of an introduction in that. But she has worked as an athletic trainer for less than 10 years, so she comes from the young professional perspective. So I will roll into that interview now. All right, so welcome to the second part of the evidence-based practice project interview. I am here with Megan Smith, and I want to give her the opportunity to introduce herself now.
Hi, I'm the assistant athletic trainer with Illinois State Volleyball, and I just finished up my third year working with them. And yeah.
Okay. Well, thank you, Megan, for joining us to answer some questions about evidence-based practice. To start off, I think it would be fair if we could just ask you, what is evidence-based practice to you?
To me, evidence-based practice would be just using the most current research and techniques in everyday clinical use, or implementing it into your clinical practice, or how you work as an overall athletic trainer, I think would be the best way to explain it for me.
Okay. And how often would you say that you feel you're able to use evidence-based practice in the athletic training room?
I wouldn't say that I do it on a daily basis. I try to implement it when I can. It seems like a lot of the topics are topics that would be used for like administrator or in a research role versus a clinical site like what I currently work in. I do my research, and I try to make sure that I'm practicing with current practices and what's been found, but I think that it's not like a daily practice for me.
Okay. In kind of going through and talking about the strategies like we have, do you feel prepared that you have the ability to kind of find that current research and find the evidence, and then also, once you do find that, implement it effectively into your practice?
So I think majority of athletic trainers, including myself, we rely on the NATA 10 free EVP credits that you get as your NATA membership. I'm thankful that my university pays for that, so I don't have to worry about that. But a lot of places don't, and so I think that it's easy to access when needed. I personally learn better in like a classroom or a lab setting. So a lot of them, as you know, for the NATA are like an online course session. I can't say I take every specific topic out of that, or it's like the information, but I think that if they had more in-class labs available, they can be super expensive too, up to like $15-20 per credit, which most EVPs are at least 3 or 4 credits at a time if you're doing a lab. And athletic trainers don't get paid a lot, so yeah, we don't want to spend extra money. Again, I'm thankful that my university pays for it, and then I get to utilize those resources. And so it's available, but I don't think as available as available as it could be for everyone, because of a money limitation, but then also just a limitation in like learning style in that sense.
Mm-hmm. Do you see kind of any other challenges besides the financial that you've talked about that can kind of stir people away from evidence-based practice?
Yeah, I kind of mentioned in the beginning. It's a couple things is that it's a lot of the information are topics that aren't necessarily super relatable to your daily practice or how you run your athletic training room or um, how you may practice as a preceptor, whatever it may be. It just doesn't seem directly applicable. Um, there are topics that I do thoroughly enjoy, but other times that I think it's just a topic that I feel like they've got to kind of check their boxes to do. We have to listen to them anyways because we need our EVPs, but I can't say we fully are engaging in those topics. And I think it would be better if we were to really engage and make our members go to classes and take, I mean, a lot of the NATA quizzes or whatever are only 5-10 questions, like not super hard.
Yeah, yeah, right. Okay, well, kind of thinking long term, and this is kind of a question to wrap everything up, but do you feel that the strategies for finding evidence-based practice and then um, also kind of the encouragement to go and like search out more of them, do you think that should continue to be encouraged in athletic training, especially in like education and moving up with new athletic trainers?
100%. I think that the basis behind it is very smart, and I think that we all should be practicing with current research and current information, and that should be something that we all should be working to be continuing to be better athletic trainers. And starting when we're younger, when we're first learning and learning how to be an athletic trainer, and the education portion, and stressing the information of like the reliance of making sure that you are participating in these types of things. I think that's imperative, and helping our profession grow and continue to evolve, because it's continuing to evolve into what our role can play. And if we can keep putting more tools in our toolbox, then we're more of essential and I guess more expected or more respected as a medical professional.
Great. Well, thank you, Megan. I appreciate all the answers that you've been willing to share and the opinions. So with that being said, we'll move on to the next part of the interview. So welcome to the third part of the interview in the evidence-based practice project. I'm here with Matt Munjoy, and I want to give him the opportunity to introduce himself now.
My name is Matt Munjoy. I'm the manager of sports medicine and athletic training at Decatur Memorial Hospital. And I've been there, been an athletic trainer now for about 17 years.
Okay, thank you, Matt. Thank you for joining, and thank you for providing some of your own insights and opinions on evidence-based practice. So to start off, pretty simple question that you can answer in whatever way, but to you, what do you see as evidence-based practice?
It's kind of the combination of research, obviously research-based techniques, and what we're going to provide in the clinic to get the best outcomes for the patients that we see. In our setting through the hospital, we're a hospital and outreach-based program, and serving about a dozen high schools in the area and a local university. That there's a lot of what we try to incorporate both from the rehab side and to our on the sports medicine side as well. But it's basically a combination of make sure we're using research, using whether it's journal articles, obviously the peer-reviewed articles, or our outcome studies that we have on our own through the hospital as well.
Great. So you've kind of touched on a little bit of what you do, but how often do you feel that you are utilizing evidence-based practice in the athletic training room and the different ways that you use it through your company?
Sure. In an athletic training room in the secondary school setting, it's a little different. and we get back into the business models, how that athletic trainers are in with the high schools. The high schools that hire their own athletic trainers and they're there all day. I think it's a little bit easier to incorporate more the evidence-based practice because you're with the athletes every day. There's more of a structure to it. In ours, it's a little bit more difficult at times. The high schools that I provide coverage at, or athletic training services at, and some of our other more full-time high schools there, it's a little bit easier, again, because we're with the athletes a little bit more, but it still presents a challenge because, you may not see those athletes every day, and your evidence-based, the techniques you're using, the practices that you're using, kind of fluctuate in terms of how often you're able to be around those. In the clinical setting, we use them all the time. And again, it gets back to the structure and how much we're dealing with those patients and those athletes with our university structure that we have, and our athletic trainers that cover there. It's definitely used every day, and we make sure to send those staff members to the appropriate courses to learn that evidence-based technique and make sure they're incorporating that into their practice daily. But getting back to the original question, I guess, with the secondary school setting, just depends on how often we're able to be with those and those athletes, and how often we're able to progress their treatment and their rehab and utilizing those skills.
Okay. How do you kind of help yourself and help people on your staff? How do you try to feel prepared to kind of incorporate those evidence-based practices? Because I know there are a lot of people that they may go to an EBP session at any type of conference, and then they have that kind of information, but then they might not know exactly how they need to do it, or if they're trying to kind of create their own evidence-based practice in their own way, kind of they're struggling with going out and asking the questions and finding like the relevant research that makes it kind of line up with EBP. So, do you feel that you're kind of prepared to do some of those strategies, and like what ways do you get yourself to feel more prepared?
That's a tough one. I'm really prepared to go about that. I will say a lot of the EBP stuff that we sit through, whether we're going to like the national meeting or district or what, any EBP sessions that you sit through, I don't think it's just going to turn into, okay, you're not going to be prepared for it. That's your initial just experience, with that. And I think it's upon the clinician, the athletic trainer, you're going to have to do your own research and figure out how you're going to incorporate that even more. That is the difficult part. I think there are some things, you can kind of go through and, okay, kind of have an idea sitting through that. I think you hit the nail on the head. You're trying to incorporate, okay, what have I done before, and how is that going to match up with EBP? I'm sitting through, and yeah, that'd be great. That'd be easy. But I think there's going to be some things out there that are, like I said, just your initial experience with sitting through maybe a course or two that are EBP. Okay, now how am I going to formulate that plan and doing the research on your own is going to be what the difficult part of that is. Now, I will say in our setting and where we're at, it's tough. It's tough to do that. It'd be great if we could, we sit through a course and, okay, let's try to implement this into our treatment plan, into our patient outcomes and things. Let's see how this is going to work. And then, okay, this is working well. Let's, incorporate a little more of that EBP into it. So it's more, it's definitely not hit the ground running when you get back from just sitting through, an EBP course. There's a lot more, work on the backside of that needs to be done. And I think that's where the challenge is to making sure that our staff are able to get that. So if there's somebody on staff that they go through something, they come back and say, hey, this is something we want to try to look into a little bit more. Yeah, let's do that. And we'll, try to help them along the way, or help anybody on our staff and a group of them. Like, yeah, we need to incorporate this more. We need to look into whatever more research there is to it for that.
Okay. You've kind of even touched on this a little bit too, with having a variance of resources at different places, but what do you kind of see as the barriers or challenges to fully kind of using evidence-based practice all the time?
It's the time to do it. You know, some of the research that I've read through, I think some people list cost as a barrier and things like that, and I guess it could be depending on what you're implementing. The time you're with the patient. We've had a lot easier time implementing evidence-based with our patients in the rehab clinics and with our athletic trainers working with our PT and PTA staff, and really working as that team from an evidence-based standpoint of what the clinician is bringing to the table and having everybody else is on board with that. And that's where we get that. It's more that getting back to the structure, and we're able to kind of immerse ourselves in that till it becomes just, that's part of our training, that we do. And but to me, it's the time that it takes to really get involved with that, and the structure of how often we're with those athletes at the schools. Again, getting back to the secondary school setting, with that, it's just the time and the structure, I think, are the big ones.
Okay. Moving kind of forward, looking at the kind of the future outlook of athletic training and where the profession can kind of go, in the idea that athletic training compared to other healthcare fields there are different points in terms of their use of evidence-based medicine, evidence-based practice. Do you think that evidence-based practice and everything kind of with that should be encouraged and taught more in kind of like athletic training curriculum?
Sure. Absolutely. I do. And part of that is, when the NATA and the BOC and the profession kind of went the way of incorporating EBPs into our CEU reporting, period. My opinion was, I think that a lot of, and the fact that when we report 50 CEUs every 2 years and 10 of those have to be EBP, I get that. It's that initial immersion into it. To me, and it's tougher on the side of the people who have to get them certified for EBP, but most of our research, most of our learning should be evidence-based. And I think that from a curriculum standpoint, it's going to make the student more prepared, no matter where they're falling in. Obviously we're going to the ELM with the entry-level masters, but doctorate students, I mean, it makes the entry-level point to the workforce that much. I think it makes our profession that much better to have more EBP and incorporate into the curriculum, and potentially even into the continuing ed, piece of it as well. And like I said, I know we label EBP with our CEU things and how the BOC goes through that, but to me, I think it would help us out more as a profession if that were just almost the norm. And I know that probably not the popular opinion with that, but I think it ultimately, on the other end, when you come out of your education, part of your training, and you get into the workforce, I think that's just going to help you and help the patients out, help the athletes out, and help the profession out as a whole. It just, anytime we can get to where we're doing best practices and there's that constant increase in education, you never want to stop learning. I think there's no way that can't help us.
Yeah. One kind of final question to wrap up. What would you suggest to a new, young, kind of right out of the undergrad or the entry-level masters? What would you kind of suggest to a new athletic trainer regarding EBP and how to kind of maybe get it incorporated early, so that it doesn't become something else that should be added on within the next couple of years?
Right. It is about making just, I don't know, to me, it's making it automatically a part of your practice and part of your learning ability right off the bat, early in the process. Just that's what it's going to be. Make it a habit, a good habit to get in to start with. And I think that's where some of the pushback has come from with a lot of the people, and I'm getting to be one of those now, and I hadn't thought about how long I've been in this career until we sat here tonight. But I think that's where you get some of the pushback. People have been in this a long time. I already know. I already got my ways of doing this. Well, there's, evidence may suggest other techniques may be better. Other protocols may be better. So coming right out of school, the first thing I was told coming out is never stop learning. Obviously, we have to with CEUs, but never stop reading articles, never stop looking things up. The amount of books that I have, in my high school athletic training room, just from a reference standpoint, and the journal articles that come out very often, that you can never stop learning that stuff and never stop doing that. So now, okay, let's add EVP onto that. Never stop, get in that frame of mind where this is where I need to go with my profession if I'm going to be in this long term and have the outcomes that I want with my athletes and my patients.
Great. Well, I really appreciate those answers and your opinions and what you were willing to share. And now that we've heard from the two interviews that were they're really great for me to kind of hear those two perspectives, and hopefully you enjoyed them as well. I just wanted to kind of provide a closing remark talking about some of the things that they touched on. I want to speak specifically to where they've talked about how there's different challenges based on the resources that they have available, and kind of the access that they feel they have to evidence-based practice, and tie that into how all of us as athletic trainers may have that type of access. I think it's a great thing. It's a really great thing that because of BOC guidelines now for CEU reporting, 10 of them have to be evidence-based practice related. I think that's a really cool advancement to see, knowing that that wasn't always the standard, and kind of hearing now that there's a lot of different ways to get those CEUs. And so hopefully, like we heard in the interviews, that becomes more of the standard, and that evidence-based practice can kind of become something that is commonplace with all athletic trainers and in all athletic training settings. So again, I just want to say thank you for watching, and thank you to my interviewees for providing their opinions. And you all have a nice day.